What is the best type of therapy for kids with ADHD? This answer might shock you, so stay tuned.
That's the name they gave me.
Hi, I'm Ryan. I'm a licensed clinical social worker, school social worker, certified ADHD clinical services provider, and my most important job is I'm a father to a son with ADHD. So I want to start off by telling you the American Academy of Pediatrics treatment recommendations for kids with ADHD. For children 6 and up, that is medication management in conjunction with parent behavior training. That's the part I do. The American Academy of Pediatrics does not recommend individual therapy or counseling for kids with ADHD, and no type of therapy has actually shown to be effective in addressing ADHD-related challenges. So you might be thinking to yourself, Ryan, that can't be true because my son's pediatrician or his psychiatrist or his guidance counselor recommended individual therapy for him. I know they did, and here's why. Most professionals do not know the American Academy of Pediatrics treatment recommendations. I follow those recommendations and expand on them because I find that they work and it's the most time and cost-effective way for families to get help. You might have had cognitive behavior therapy recommended to you. Well, cognitive behavior therapy has been shown to be effective in older adolescents and adults with ADHD, but not kids. There's 2 reasons for that. Number 1, CBT or cognitive behavior therapy requires a great deal of motivation. And number 2, because CBT requires a great deal of self-talk, what I call brain coach with kids. Well, that is underdeveloped in kids with ADHD because essentially that's what ADHD is. It's a lack of self-directed talk. But that is why it can work for older adolescents and adults because their self-directed talk is much more developed by then. If you think it would be helpful for your son or daughter to talk to somebody, ask them if they want to, but please don't force them to go to therapy. Keep in mind that most therapists have no specific training in addressing ADHD, but if there's other reasons you think it might be helpful for your son or daughter to go, definitely ask them, and if they don't want to go, that's okay, don't force them. Because what you don't want is for them to develop an adverse reaction to therapy because they had a negative experience, which so many kids with ADHD do. Because let's say one day when they're older and they could really use therapy, you don't want them looking back and saying, you know what, I went to therapy before and I didn't like it and I'm not going now. So we want to keep them open-minded about it by not forcing them to go. Which is why I suggest do not force kids to go to therapy, but it's fine to ask them with the understanding that it's not going to address their ADHD-related challenges. If you're interested in learning more about parent behavior training, please check out the ADHD Dude membership site because I have created the first ever parent behavior training program specifically designed for parents of kids with ADHD. Right now, stay tuned for my next video so you can be empowered with practical strategies to help your son or daughter reach their full potential and not be living in your basement when they're age 30. Take care.